In this video, we'll discuss about serum electrophoresis pattern in nephrotic syndrome, cirrhosis of liver, chronic infection, multiple myeloma, and acute inflammation. So, by serum electrophoresis, we can understand the different clinical condition. We can understand different clinical condition and how this condition we diagnosis with the help of electrophoresis, that we will look. First one is nephrotic syndrome. Nephron damage. When the nephron damage, first protein to excrete, that is albumin. Albumin will lose in the urine, that will lead to hypoalbuminemia. Hypoalbuminemia by comparatively bigger size molecules. Bigger size molecule will be remain inside the blood, that is making predominant alpha 2 band. So this one will show predominant alpha 2 band. Now the nephrotic syndrome electrophoresis pattern and a normal pattern, that is compared here. So this one is the normal pattern, this one is the nephrotic syndrome. When the electrophoresis is run, the starting point from where the sample is applied, here after application electric current is passed. Based on that electric current, the different band will be found, different band. So the normal in agar gel electrophoresis making 5 particular band, that will look 5 different type of band. From starting point gamma, second one is beta, third one is alpha 2, next one is alpha 1, lastly albumin. Albumin that can move fastest from that starting point. This one fast movement it have. So that albumin band, now with the help of normal pattern under nephrotic syndrome pattern, this one is the nephrotic syndrome pattern. Alpha 2 band is found in nephrotic syndrome. Alpha 2 band presented in nephrotic syndrome. Further albumin band that is decreasing, albumin band decreasing or not show prominency, that is indicating hypoalbuminuria. This one decreasing, so it indicate hypoalbuminuria. That from the pattern of electrophoresis, we can understand that nephrotic syndrome patient serum electrophoresis, that is indicating nephrotic syndrome because of this hypoalbuminuria and predominant alpha 2. These two characteristic, hypoalbuminuria and alpha 2 band, by using this one we can confirm nephrotic syndrome. Now further another condition will be discussed here, cirrhosis of liver. Serum electrophoresis pattern and a normal pattern here. This one is the normal pattern, this one is cirrhosis of liver. Liver have a particular function, albumin production from the liver. If cirrhosis of liver, albumin production will decreasing, that will lead to hypoalbuminuria. Here also it leads to hypoalbuminuria condition, as well as beta gamma bridge. So beta gamma bridge here. So in this condition hypoalbuminuria and with beta gamma bridge. A simple gamma globulin or immunoglobulin that is made from this plasma cell So plasma cell is presented in the bone marrow comparatively to maintain total protein level. Comparatively high alpha globulin, gamma globulin, high gamma globulin or production is there that will look in the electrophoresis pattern. Again the starting point and that end point negative to positive, negative to positive, highest movement of albumin will be seen. Third condition, chronic infection. Whenever infection is there, that acute protein level will be increasing. Normal and chronic infection. Whenever infection is there is that acute protein level increases. Third condition, chronic infection, that time protein level will increasing. Normal and chronic pattern is compared here. This one is the normal, this one is the chronic infection. Chronic infection broad that band increases in gamma region, gamma region band increasing. General increases in alpha 1 and alpha 2 also. So gamma, alpha 1 and alpha 2. Comparative reduction albumin band electrophoresis pattern. Then multiple myeloma condition. One particular type of immunoglobulin is producing excessive amount as well as excessive amount of production that indicate particular band between, okay, so band, particular band presented between beta and gamma, beta and gamma in between band formation, that name is called as M band. Again electrophoresis starting point that is separated into 5 different band, gamma, beta, alpha 2, alpha 1 and albumin. Now that particular two patterns seen here. Here you should be serum sample. Suppose the plasma sample, plasma and serum are main difference of fibrinogens. Apart from that serum content, the fibrinogen is presented. So plasma is equal to serum plus fibrinogen. So plasma sample, that particular band are seen, particular band here because of that fibrinogen M band, because of fibrinogen here M band seen in fibrinogens. Multiple myeloma serum sample is needed. For in this one serum sample needed. Last one is acute inflammation. Again that inflammation reduced albumin and increasing alpha 1 and alpha 2. Alpha 1, alpha 2 and gamma globulin. So here reduced albumin and increasing alpha 2, increasing alpha 2 and this one decreasing this albumin level. By using electrophoresis 5 band gamma, beta, alpha 2, alpha 1 albumin, particularly that gamma globulin, showing that gamma globulin showing prominency, reduced albumin level. Okay, so here reducing albumin level, reduced albumin, increasing alpha 2 gamma globulin level. So with the help of normal pattern and serum sample of different clinical condition of that patient is compared here. Thanks for watching.